cryopreservation or egg freezing or oocyte banking. What is egg freezing? Egg freezing, also known as oocyte cryopreservation, is a method of preserving reproductive potential in women of reproductive age by extracting, freezing, and storing a woman's eggs, oocytes. In 1986, the first human being was born from a frozen oocyte. Over the last few years, oocyte cryopreservation has advanced significantly with a higher overall success rate of eggs surviving the freezing process. It is no longer considered an experimental procedure and is now a leading tool for improving gamete survival, possible fertilization, and live birth rates, giving women far more liberty. Who needs egg oocyte freezing? Cryopreservation of the oocytes can be considered for a variety of reasons. Women who are undergoing chemotherapy or pelvic radiation therapy, which may have an impact on their fertility. Ovaries may be damaged as a result of surgery. Because of chromosomal abnormalities, for example, Turner syndrome, fragile egg syndrome, or a family history of early menopause, there is a risk of premature ovarian failure, ovarian disease with a risk of ovarian damage. Ovaries must have been removed due to genetic mutations, for example, BRCA mutation. Fertility preservation is used to postpone childbearing for social or personal reasons. You will usually have some screening blood tests before starting the egg freezing process, including ovarian reserve testing is a procedure that involves examining the ovarian reserve. On day 3 of your menstrual cycle, your doctor may test the concentration of follicle-stimulating hormone and estradiol in your blood to evaluate the quantity and quality of your eggs. The results can be used to predict how your ovaries will react to fertility treatments. Blood tests and ultrasound of the ovaries to get a more overall understanding of ovarian function. Screening for infectious diseases such as HIV and hepatitis B and C. Your fertility specialist may undertake an assessment of your ovarian reserve to predict the possible production of oocytes prior to the ovarian stimulation cycle. Blood tests and a pelvic ultrasound would be a part of the evaluation. This will also help in determining the correct medicine dosage. Ovarian stimulation is performed using injectable hormone medicines in the same way that in vitro fertilization is done. Following stimulation, the ovarian follicles, oocytes, and surrounding fluid are extracted vaginally while the patient is sedated. The eggs are examined under a microscope for maturity, and those that are mature are cryopreserved. Currently, vitrification is the preferred approach for cryopreserving oocytes, which is performed by rapidly cooling them into liquid nitrogen. Steps to follow for the female after the egg retrieval procedure. Within a week of egg retrieval, you should be able to continue routine activities. Avoid an unplanned pregnancy. Avoid unprotected intercourse. Contact your healthcare provider if you have fever of more than 101.5 degrees Fahrenheit, 38.6 Celsius, any abdominal discomfort, urination problems, or heavy vaginal bleeding. The cryopreserved eggs are placed in a warming solution and examined when the female is ready to use the frozen eggs to achieve pregnancy. Those eggs that survive the freezing process are fertilized with the intracytoplasmic sperm injection (ICSI), which involves injecting a single sperm directly into the egg, and the fertilized eggs are grown in culture until the embryos are ready to be transferred into the uterus to achieve pregnancy, which takes about 3 to 5 days. The clinical pregnancy rate per oocyte has been estimated to be between 4 and 12%. However, because egg freezing is still a relatively new technique, additional information is needed to get a better idea of these success rates. In general, the woman's age at the time of egg freezing and the number of accessible eggs is the two most critical criteria in determining the probability of a live birth. There is no evidence that newborns resulting from previously frozen oocytes have a higher risk of congenital abnormalities than births resulting from fresh oocytes. However, more long-term evidence will be required to fully assess these concerns. The risks associated with the oocyte cryopreservation procedure are the same associated with ovarian stimulation for IVF. These risks are similar to those associated with ovarian stimulation for IVF. Ovarian hyperstimulation syndrome, for example, enlargement of the ovaries and fluid accumulation in the pelvis and abdomen, infection, bleeding connected with the egg retrieval technique. Keeping the eggs for prolonged periods of time does not appear to have any harmful impacts. However, data can only be stored for up to 4 years. When having a pregnancy, it's important to understand that higher mother age is connected to a higher risk of pregnancy issues like high blood pressure, diabetes, and cesarean section. When these gametes are utilized to achieve pregnancy, most clinics impose an upper age limit. As per the Assisted Reproductive Technology Regulation Act 2021, an egg sample shall be stored for a period of not more than 10 years, and at the end of such period, such gamete or embryo shall be allowed to perish or be donated to a research organization registered under this Act for research purposes with the consent of commissioning couple or individual. How much does egg freezing cost? The cost of the procedure is determined by whether or not there is any insurance coverage, which is determined by the individual plan. Many insurance plans will cover the initial evaluation as well as a portion of the treatment. Posthumous gametes collection and freezing. The collection of gametes posthumously shall be done only if prior consent of the commissioning couple is available to the Assisted Reproductive Technology Bank.